Hey everyone, welcome to the Between Tides podcast. My name is Jared Poe. Joining me today as well, Michelle
Cooper.
Cooper. There we go. Got that right. So the point of our podcast is just to spark some interest, hopefully to educate you, maybe get you just talking, just having a fun conversation. And today we are joined with a special guest back kind of by popular demand. If you haven't seen our previous episode, we had a physician assistant come in. We got to hear some interesting, we've seen some things kind of stories. We've got more stories.
Hello, friends. We're exploring the topic of we've seen some things with our friend Natalie. She is a NICU nurse practitioner. I almost said nurse physician. That's not a thing.
Nope.
Okay.
Well, there are NICU physicians, neonatologists. A neonatologist is a NICU physician.
Would you be a NICU?
Absolutely not.
Okay. Yeah. Why don't you tell us about your job? What do you do? How did you get into it? What are your credentials?
Well, I'm a nurse first, and I went on to become a nurse practitioner.
Can you go ahead and define that for the audience? What's the difference between the two?
Sure. So a nurse, well, everyone knows what a nurse is, right? A nurse practitioner is advanced practice nurse practitioner. So it requires more schooling, usually a master's degree. And nurse practitioners need to specialize. And my area of specialty is neonatology. So I work with newborns, primarily in the neonatal intensive care unit. And then
those are basically babies that need more advanced care, like as soon as they're born, they may have difficulties or complications, or
sure, like there's different types of NICUs. Like they're categorized by level 1 through 4, 4 being the most severe. I spent the majority of my career in a level 3 NICU, and our specialties were pretty much babies that were born too early, so prematurity. So the nature of my job is that I spent a lot of time with the families, and then there are patients for a very long time until they grow and graduate the NICU and go home.
Graduate
The NICU. Yeah.
they have a little ceremony, or like
They do. They get little graduation caps.
do
They do. Yes.
Okay. Well,
Yeah.
good for them.
That's
cute.
Okay. So for the listeners that may be curious to know, like, what was your educational path? Like, did
Oh,
you
boy.
go to college and then you just go right into it? Like, what was it?
Oh boy. Okay. I think this is a good story. So I grew up in a family of 4. I'm the youngest of 4. And I was much of a selfish teenager, I'll say that. And my first degree is in nutrition, and my summers in college I spent at the beach working. So in my young 20s, I took a career path where it was food service management, but it was like really like, I wanted to work in the test kitchen, like if the Bloomin' Onion at the Outback. Like it was all about the food, not so much management. So
Cool.
my employer hired me and they said, "Where do you want to be?" Well, I was fresh off my beach days, so my response clearly was anywhere there's a beach. So I moved to South Florida. And I burned out very quickly because it really was less about the food and more about hospitality and tourism. And I moved back home to Pennsylvania, where all my family is from. And I literally said, if I want to live in Pennsylvania, what is there to do here? There's a lot of hospitals and there's a lot of
not too many
schools.
beaches, right?
Not too many beaches. I knew I wasn't
Lot
going
of
to have a
Bloomin'
career
Onion.
in tourism here. So I said, I'll be a nurse. And I was like, I never dreamed about being a nurse. I never
Wow.
woke up and said I want to be a nurse. So I threw myself into nursing. And part 2 backstory is my mom. She's been a foster mother for like 40 some years. So there was always a baby like in my household growing up. And being the person that I was in those days, I was always annoyed that there was a baby in our house at all times.
So that was a plot twist. I did not see that one.
Yeah,
coming.
I know, right?
I thought, like, I was very advanced
fact-
and very experienced. Like, here we go.
My mom actually used to say to me, like, I never imagined you, of all my children, to be the one to work with babies. It's like, thanks, Mom.
Yeah. Aw.
However, like when I went to nursing school, when I went to nursing school, our very first like clinical rotation, I was in an adult like med surge like unit, and my task was to bathe the patient, like, and I went in, and It was a very large patient, to say the least, and I started to wash the patient, do my job, and I lifted a certain part of her body, and a chicken bone came
No.
out of her.
What?
No.
Yes. So I literally was like,
Did they miss that in the operation or?
well, no, she just literally lost a chicken bone, and I started laughing, like inappropriately
Whoa.
laughing.
What did she do?
Well, she just, I don't know, she just kind of stared like there was obviously some mental health issue there.
Oh.
But my co-nursing student was on the other side of the curtain, and she started laughing. And I don't know if you've ever been in one of those situations where
Like the
you're
giggling
like,
fits.
I
Oh
can't
my
laugh
gosh.
here. I know I'm not allowed to laugh here, but I can't stop.
Oh my gosh.
So
It also seemed like that wasn't perhaps the first time that it happened.
no. So I got I got myself together, and
Good for you.
this is well, you said you wanted truth. This is the truth. She then proceeded to use the bedpan. Okay.
Right.
Yes.
Okay.
Right. And I'm giving her a bath. So this is my job.
Okay.
I was completely by my side myself. I'm like, I can't do this. Like, this is not me. Like, I cannot do this. I don't know, someone else. So I started walk out of the room, to get control of myself. And I walked into the most perfect nursing instructor ever. I mean, this lady looks like a flight attendant. She is just like a Barbie doll. She's so perfect. And she looks at me and she takes her finger and she gives me that little nod, like, no, no, no. I don't want to hear it.
Oh.
You wipe front to back. Front to back. So that very first clinical experience, I was like, I'm done. I cannot be a nurse. This is not for me. Like, there's no way. Like, I just was not cut out for this.
Barbie just gave me special instructions.
I don't like them. So
you went back in. And
I finished the clinical. Obviously, I was just having an emotional day, and we got to the peds rotation, like the
What's peds?
pediatrics, like the kids part of
Okay.
nursing school. And this, for real, are people that cannot hold a baby. Like, they are terrified of a baby. And I'm like, what is wrong with you? Like, they're babies. Like, just pick them up. I didn't realize how natural it was, inside me to
Hold a
care for a
baby.
baby because of all those years with my mom. So I took a NICU rotation, and I fell completely in love. It was like an aha moment. Like, this is where I'm supposed to be.
I'm assuming it was chicken bone free from then on.
Chicken bone free.
All right.
No more chicken bones. Yeah. Well, wiping a baby's butt is much different than wiping
I
an
was
adult
just
butt.
gonna say, I feel like if you're wiping a kid or a baby's butt, it's easy to excuse it and be like, they literally don't know better or they can't do it the
No.
right way. But for an adult, I'm sure immediately you're like, you're the problem here and I have to fix it.
They don't talk. Babies don't talk. They really don't talk.
Do you prefer that? Like, I'm imagining if I had to wash another person, I'd be like, so, what do you like to do? I wouldn't want it to be silent.
Oh, I sound so
Don't make eye
uncompassionate.
contact. Like what we're doing.
I feel very uncompassionate saying this, but I was like, can you help me?
Yeah.
Can you help a little?
Yeah.
You have the ability.
My mind went to I have 2 boys. I've been there. I've done all that. But I just think babies less surface area, a little bit faster.
Yeah, it's a small
Adult,
butt.
right?
Yes.
Little
Easier to
poops.
manage and handle. And
They're
finish.
only eating certain things like breast milk, formula. There's no chicken bones in their diet. So I don't blame you.
Yeah, so that's how I fell in love with nursing. And truthfully, the NICU, it was so comfortable. Maybe it was because I was of that childbearing age. I was really into babies and the whole starting a family time of my life. But it didn't seem like work. The NICU that I worked in was so rewarding because there was such a good success rate with the outcomes. So it really was staying with a family and then staying through the journey and then watching them progress.
So what does that look like from the moment they enter the NICU until they get to leave? Like what's a day in the NICU like?
Oh gosh, there's actually stories about this. It's a huge roller coaster of emotion, and you literally can have a great day, have a horrible day, have a great day, and you develop this relationship with the families as they're going through it. So you're on that roller coaster ride with them as well. Like it's hard. It's really hard not to get personally involved.
Yeah.
Uh,
How long is like an average stay, if you will, before they graduate?
um, well, it depends on how early they're born. I
Sure.
mean, 23 weeks, 22 weeks
Oh
is
my.
viability now, and some babies will be in the NICU 3-4 months.
Oh, really?
Yeah,
So yeah, you definitely get to know them and the parents. And
yeah.
are the parents allowed in the NICU?
Oh,
Or
yeah, they're
okay,
allowed in 24/7. They can actually, like, sleep in the little room with
I
them.
was just gonna ask that.
They do so much better when the parents are there. They truly do.
yeah,
Are you
just being near
serious?
and the touch and
Yes.
everything else. Sure.
Yes. Yeah.
I love that.
I know. There's a lot of good little heartwarming stories about the
Well,
NICU.
give me one. I'm about to cry.
Well, there is, he is probably somewhere around junior, senior in high school now. So obviously, it's a good ending. But there are 2 very large hospitals in Pittsburgh that compete for the baby, for naming the New Year's baby.
What do you
Like,
mean?
so the first baby born of the year gets all the publicity for the city of Pittsburgh as the first baby born.
Right. I thought you meant the hospital gets to name it. I was
That's
like, I don't
what
know
I
if the parents would agree to that.
We're
Like,
naming it Dr. Stew.
yeah,
Well, so we should talk about baby names.
yeah.
Yeah.
But this particular baby was born at 23 weeks. Okay. And
Oh.
so the hospital system that I worked for was not naming this as the first baby because they were not sure the baby was going to live. And this family, I will never forget them. They came in, the dad played the guitar, he would play the guitar for the baby. The little sister was like 7 or 8 at the time, and she filled the entire NICU room with colored pictures. They were the sweetest people, and we all developed a relationship with this family. And I'm telling you, 3 times during their stay, they called these parents in to say goodbye to the baby. Like, there's nothing we can do. The baby is completely, like, septic, not doing well. And that baby, I mean, there's only so much you can think of medically, and then something else takes over. This baby defied all odds. You are literally crying.
know.
This is a happy story.
Right.
I know.
That baby is now like a junior, senior in high school. And I still follow them on social media and stuff. We still have a connection, but I can't even tell that this child was ever a baby. Like, there are absolutely 0 deficits, and all of it is completely unexplained. Like, medically, if you laid out all the numbers and you analyzed everything, completely no reason other than somebody else took
Yeah.
over and, like, saved this child's life. And
And that was just like your everyday routine, is being in the
Oh
NICU.
my
I mean, obviously
gosh.
this was an isolated incident, but not isolated, but
wow.
one family, but there's multiple babies in there as
Yeah,
well, right?
there's 80 beds in our NICU.
80.
80 beds.
How
Wow.
often are they all full?
A lot. There are a lot because they get, transfers in from many different areas in the Pittsburgh area, any real complication goes to the big city hospital. I should full disclosure, I don't actually work at McGee anymore. When my second child was born, I took a job at a community hospital. So I still work for the Department of Newborn Services there, but I work in a community hospital now. We have a level 2 NICU. We deal with like a lot of drug addicted babies.
Hmm.
Stuff like that.
I was asked earlier when you were talking about going through your training to be able to
Mhm.
do all this. Like, had you already had kids, or like you were learning
No.
everything there is to learn about babies and
No.
then considering to
Oh
have
my
kids?
gosh.
Oddly, I so like a lot of what I do is I attend the high risk deliveries. Like, so there's a problem and they send the nurse practitioners to the delivery to manage the airway and like that critical time right after they're born. So my first child, I held that belly and ran up the steps so many times. We jokingly say he's going to be a doctor one day because he's responded to more baby codes than anyone. But yeah, I was going. That's hard, when you're pregnant and that's happening because you're like, I'm 28 weeks pregnant, and then I'm taking care of a 28-week
Oh
baby.
my
Right.
gosh.
That's what I was wondering
Yeah,
if that was how challenging that was, like the
Yeah.
yeah.
things you've learned and then the things you've seen versus the things you're like experiencing right now as
Experiencing.
having a baby.
I will tell you, and I don't know if many nurses feel this way or not, but um, I'm great at my job. I really am great at my job. It's like I do it over and over again. It's almost robotic. But the second you personalize it to me, I fall completely apart.
What do you
Like,
mean?
like if I know the person,
Oh,
or if like I'm resuscitating somebody's friend that I know, or I don't want to be that person. And I don't know what that is. It's like I don't want to fail them.
Sure.
It's like a lot of pressure.
That's a
Eh,
good thing in healthcare, right?
Yeah.
yeah, definitely.
And then like, obviously not every story is miraculous. Not every story ends out with a good outcome. And when you're in that situation and you're like, resuscitating a baby, something's gone bad.
Oh,
It's like I don't know how to explain it. It's like you shut off all emotion and you do exactly what you're trained. X, Y, Z, X, Y, Z. And then when you get in the car on the way home, you tear yourself completely apart.
oh,
Like, if I would have done Y before X, would this outcome have been different? And that's usually the point when I fall apart. Like, I'm fine through the whole process until I'm alone by myself driving home, and then it's like waterworks.
yeah.
I don't know. It's odd. It's very odd.
Did working in the NICU ever make you think like, I don't want to have kids, this is too much?
No, exact opposite.
Really?
Exact opposite.
Oh,
I think being a mom is like the best job ever. I want everybody to experience that. So I feel like we're like helping all those people get to that end result.
wow.
It's true. My mom would say differently.
You
But
still
truth,
haven't convinced her after like 40 foster kids and
uh,
everything you do.
she takes all the credit.
Okay.
Yeah, she does. She's like, it's because of my foster babies. Oddly, she's had a baby in the NICU while I was working there. Like,
Oh,
Wow.
wow.
yeah, so they called her to be the foster family for a baby. And really it's just support. She would go in and like hold the baby
Oh,
but she has had babies in the NICU while I was working there.
that is
See.
so. I'm still like stuck on the fact that it makes such a big difference for the babies. How do I say it? Like to have their families and so much love surrounding them.
Oh yeah.
That's so nice to hear.
Yeah. It's fun to like well, obviously the hospital, that I worked at and I'm speaking of is not close to us, but there are like people that trickle down into the community and like they'll come up and take their picture with me. Like, hey,
Okay.
I'm your 28 weeker. And I'm like the star of the football team in high
Oh,
school. Like, I don't know. I always think that I always tell my preemie graduates that I run into, I think that they surpass other people because from day one, they're
wow.
used to catching up, that they catch up and then they exceed. I don't know
That
if
is
there's
so
any truth to
cool.
that, but they're like conditioned from the very beginning. I mean, they
Aw.
learn to walk. A lot of them learn to walk with physical therapy. So then they end up being like the best athletes. Like they just have that drive to like surpass people.
Do you guys do anything for kids who don't graduate? Like for the parents who have lost a baby?
Oh gosh, yes. That's hard. There is a memorial service. The way we designate a loss is with a butterfly. I
Just
know.
don't look at me. I'm not even kidding.
So if there's a loss, we have a butterfly garden and there's a ceremony every year and I don't think I like butterflies anymore. I think it's totally scarred me.
Oh, wow.
Like when my kids were little and like someone would buy my little girl like something with butterflies, I'm like, oh please don't wear that. Like, please don't wear that. Yeah, that's hard.
You told us to ask you about baby names.
Oh yeah. So as you can imagine, in the birthplace, 80-bed unit, and no laws in the state of Pennsylvania to protect the poor child from these horrible names.
No.
Guess some of the baby names. I mean, just
7-Up.
how about Ice Cube?
No.
Oh, yeah.
Favorite one I've ever seen. It was on a medical chart. We saw it. It was L hyphen AH.
I know what it is. I've seen it.
Ladasha.
Yes.
There you go.
Okay. See if you can get this one. I wrote one on the end of your paper here. How do you pronounce that?
Jacquemino.
JKMNO.
Just kidding. My name's Owen. Come on.
I feel like I've seen this one before. It's significant because the L is missing, and so
Yes.
Noel.
Yes, that's it.
There you
Noel.
go.
That is Noel. I'm
Good
like,
job,
you're
good job.
kidding, right?
teamwork. Good job.
I like mine better. Just kidding. My name's Owen. You guys didn't laugh the first time, so edit the first time I said that out.
Okay.
Thank you.
How about this one? You said you wanted gross, but we had a baby. You know, every little baby room has a board with their name on it, and this patient was in there for a long time, and it said Neisseria.
What did it say?
Neisseria. We're like, is anyone going to tell this poor mother what that is?
What
Would you
is
like to
it?
explain that to our general audience?
Yeah.
That is the medical terminology for gonorrhea.
Yep.
Neisseria,
not.
gonorrhea. So
It's just such a pretty name.
You
It sounds
guys,
so
I
good.
thought it was like a city in Egypt. Nice.
am I pronouncing it right?
Yeah.
Yeah. Okay.
It's
So this nurse
Causative
goes-
agent for
they wrote
gonorrhea.
the naming board. She goes into the room and she's like, I just have to ask you how you came up with this name. And the mother proudly goes, I saw it in my medical chart and I thought it was so beautiful.
No.
Do we dare ask what the middle name is going to be?
No, but thankfully that mother changed the name. She
Oh.
had no idea.
Oh my gosh.
There are some states that have laws against baby names.
Like,
Really?
what would the law consist of? Because I feel like that's such a weird.
Like you have to like protect the welfare of the child. I think South Carolina, that's where Charleston is, right? There's
Right.
a big,
Is that basically a nice way of saying you can't name your kid something stupid?
Yeah.
But then what constitutes a stupid name?
Probably an inanimate object or something that
Here's an opportunity
like
for
that.
us to offend multiple listeners.
Oh, boy. Edit.
No.
Wow, I probably anything that like would put them in harm's way. I would
Like certainly like nothing vulgar, nothing
nothing vulgar. Yeah, right. Can you imagine if someone named their kid a vulgar word? Like
Like poop.
it's a nice way of putting it. Yeah.
Yeah.
Wow. Which that has been oddly a baby name, meconium. Meconium is, yeah. So we've seen meconium as a baby
Is
name.
meconium like a nice way of saying poop?
Mm-hmm.
Mhm.
Is this a normal thing that medical
baby.
people
But
know?
yeah,
Oh, okay.
Yeah.
like meconium staining.
Oh,
yeah.
Yes.
like guano is bat poop.
I did not know that.
Now you do.
Yeah. Was this in any way related to the gonorrhea family?
Not at all. Not at
They
all.
were cousins.
Yeah. I
So-
think there should be laws.
Is this legitimately a name?
Yeah.
JKMNO.
Yeah. That was what they named the baby. Noel.
How's Noel doing?
Well, like
now?
that poor child has to explain that the rest of his life. Her life.
Yeah. But how are they doing now? Like, have you gotten to check up on them?
Yeah. Have you gotten to take a
Negative.
selfie with her? Like,
Yeah.
like take-
Negative.
Negative.
Oh.
Dang.
No.
If you're
Cool.
out there, leave a
All
comment.
in.
Yeah, we'd love to hear from you.
How's
What's your
that
life
name
been
going
like?
for you?
What's it like getting a driver's license or going through security
Yeah.
or having your name called from kindergarten to high school?
A substitute teacher.
Oh boy.
Oh. Were you ever asked to help name a baby, just having spent so much time with them in the NICU?
Honestly, no. A lot of times parents will like give like a couple of their, the mom and dad are like arguing nicely over what they feel the name should be, and they'll give you like 3 scenarios of
Uh-huh.
what they want, and then they're like, which one's your favorite?
Uh-huh.
I'm
I'm just
never.
imagining like the population of Natalie's in this area has just
Oh,
boomed like in the
no.
past decade. And you're like,
Yeah.
there's a lot of Natalie's.
No. There was one year in the NICU. I hope I'm not offending another population, but it seemed like every single baby name like Jaden, Aiden, Caden, Braden, anything that rhymed in an Aiden is what the boy names were.
Interesting.
And then, there was like certain girl names that like just kept resurfacing again. And you're like, right now it's Liam. Everyone's Liam and Leo.
There are a lot of Liams.
Liam,
Well,
Leo for
And
boys.
interesting statistic. I heard kids named Michelle grow up to be really sexy.
I haven't seen a Michelle in a
You're looking at one.
while. I know.
Living proof.
I haven't seen.
I like how you said it's a straight face the entire time. Yeah.
Just kidding. I didn't hear that statistic. I made it up.
I never see like Jennifers or Michaels. Like that was my generation.
Yeah.
Nope.
It's interesting because names that we associate with like a normal person eventually are going to be old people names. Like Tiffany's going to eventually be a grandmother name.
Yeah.
But Tiffany was such a cool girl name back in the day.
Yeah.
Or Noel.
No.
Let's imagine like
Yeah.
what her stocking says at Christmas. You're just like, which one do they go with?
I don't know. Man.
Okay.
Do you have any interesting, like, you said upstairs you had so many crazy stories. Which ones come to mind?
Okay. These are bad. And none of them are bad patient. These are bad Natalie stories. So when I first became a nurse practitioner, I was very eager to like learn. Like, you're just green with, you want to be
It's a good
involved
thing,
in every
right?
situation. So I joined the transport team for children's.
What's the transport team?
So they're the babies like, you have an emergency from another hospital and you need them to come get the baby. So like,
Is this
it's-
like ambulatory
Yes.
transfer or like life flight?
well, there's both. I never graduated to the life flight
Okay.
team. They had the coolest jumpsuits ever. I always wanted to wear one, but no, they look like Charlie's Angels when they come in, and they're. But I was
Okay.
on the ground transport,
Okay.
and it was, my shift was over at 7:00, and I get this phone call at 6:30. They need me to go to a hospital east of Pittsburgh and take the baby to Children's Hospital, Pittsburgh. A stable baby. The baby wasn't like really
Okay.
compromised. It was going to have a procedure done at Children's. So I'm like, oh man, couldn't this call have come in after my shift? I just want to go home.
So when you say like it's a normal baby, like it's in a
Like-
NICU at another hospital, or like why couldn't the parents just bring the
So, okay, so this baby
Yeah.
needed a PDA ligation, which is like a hole closure.
Oh.
baby?
Which sounds very intense, but the people at Children's, they do that very frequently. It's a very successful thing.
Wow.
Yeah, they do really well.
That is so cool.
As soon as I say heart and surgery, that's scary, right? Okay.
Any organ and surgery.
Yeah.
I'm having a conniption.
So I go there, right? And I pick the baby up. Baby's completely fine. And outside of the Pittsburgh, there's the Squirrel Hill tunnels.
Sure.
And then it was a Justin Bieber concert day. And
No.
it was backed way up. And the ambulance kept going, "Rrr, rrr," And I got so sick. I found out later I was pregnant with my daughter. This is how I found out I was pregnant with my daughter. But I
Threw
lost it all over my shirt. So I'm in the back of this ambulance. I had absolutely nothing but a gown. So I put on like a patient gown and I tie it around me. And I go to the ambulance driver. I was like, is there anything we can do to make this process speed up a little bit? They said, you have to say it's a medical emergency. I said, okay, it's a medical emergency. Your nurse practitioner is falling apart back here. So lights and sirens come on and it's parting of the Red Sea. And the ambulance drivers are so pumped up because like they get to like get through the traffic and they're like, ha, and they're laughing and they're loving life. I'm like, please just don't let me puke again. I take this baby into Children's Hospital. Luckily, it was one of my friends that I know. And I'm like, listen, I am so sick. Obviously, this is the baby. This is the quickest report ever. Here's the baby. Bye-bye.
So it had to be confusing. Like you get to the hospital, doors open, and you're wearing a patient gown. You're like,
Yeah.
are you being admitted? Or is
Yeah,
My
or is
nose.
it the baby?
luckily, they're all my friends. So they're all like, what is
Okay.
happening here?
They
So,
didn't have like just scrubs in the back of the unit.
Yeah, that's interesting.
lesson learned.
Yeah.
I just wanted out of there.
Oh, sure. Yeah.
So I go back to my car and I go to get in my car to drive back home to where we live, where we are. And my keys are in my jacket at the first hospital. I took them off. It's like, this is not happening. So I called my husband at home and he drove with my newborn son an hour to the hospital and then an hour further to get my keys and then 2 hours back home. And I had to work the next morning at 7 a.m.
No.
I was like, oh,
Could you call in dead?
they don't care.
Sorry,
They don't
Natalie.
care. I know. I
died.
think like nurses, it's not a glamorous job. Like anyone going to the field of nursing, it is so incredibly rewarding, but it is so not a glamorous job
Yeah.
in any way, shape, or form. It is nights and weekends and holidays and calls 5 minutes before your shift's over to go pick up a baby and
Throwing up on yourself.
oh yeah.
Yeah. So as a nurse practitioner with the training that you have,
Yeah.
like, are you just permanently in baby world, or they ever like pluck you out and be like, nope, we need you over here. Here's the adults. Back to bathing. Like, here we
Nope.
go again.
Back to bathing.
No,
Back to having to
so
bathe, like
I
we
think
talked about.
I think you
Yeah.
talked with Alicia, who's a PA,
Correct.
kind of both mid-level providers. The difference with nurse practitioners, you have to specialize. Like there's family medicine.
Okay.
I specialize in neonatology, so I couldn't even begin. I've been in the field of neonatology for almost 20 years now. I couldn't even begin to try to like manage an adult patient, you know.
Wow.
And when people ask me those questions, I know like a little bit of general knowledge, complete failure if you like ask.
It's so
Yeah, so
interesting.
stay within your niche. And
Yes,
that's what you did.
yes.
Okay.
Mhm.
It's hard to be like a patient, you know, with family members to know a little bit, but not enough.
Right.
Well, I
Just
know
enough
this
to
is
be
not
dangerous. Just
exactly
kidding.
or
Yeah.
annoying.
Right. So Natalie, tell us something weird that you was
Weird,
unexpected.
like
Yeah.
weird, interesting.
Good idea, Jared.
Probably the
Thank you, Michelle.
weirdest thing I've ever seen. Oh, two. One I saw, and this baby lived. The baby's heart was born on the outside of the chest.
What?
Yes. So
What did that look like?
exactly what you would think it would look. It was like covered by a very thin membrane.
No,
What about like the sternum? Like,
Sternum
where
was like open.
okay.
But they were able to, at Children's, they were like able to like put the heart back in the chest. But that was very, you know, with the ultrasounds and stuff, you
Can't tell.
obviously can see that stuff.
Oh, you can.
Yeah, so they
Oh.
knew it was coming. Like it was a premeditated thing, and they had lots of team members,
Oh my
surgeons
gosh.
there, like for delivery. Another odd one was
Can we pause on this for a second?
Yeah.
So many follow-up questions.
Yeah. Number one, how was the baby born? Did it come out normally, or did they have to do a C-section?
C-section.
What was the mom?
It was a twin actually. The one twin was fine, and the other one, yeah,
So was that so heart is on the was it
outside.
is actually on the outside, just kind of exposed, so you still have the cavity to kind of put it back in?
They're
and
definitely like
suck it up?
I this is where like my brain cells are gone, so I can't explain
Okay.
like why this happens, but like there was definitely like a thin membrane,
Mhm.
but you could literally see the functioning parts.
Yay.
Just see it beating
God
in.
bless.
Yes.
Okay.
The other odd one was
Yeah, good to have a good surgeon.
oh gosh, those
yeah.
people are so incredibly talented. Like wow,
God bless.
to come up with a plan and to do that.
I know.
They're operating on babies like in utero now.
What?
Yeah. They're like spina bifida patients.
Right.
And it's safe. It's not like this has a 40% success rate. They're like actually safe surgeries.
Well, I don't know. I don't know. I don't know the
Yeah.
success rates, but
Wow.
it's just crazy. Medical like technology is really
Yeah.
wow.
It's crazy.
Research and
Yep.
you know, we weren't doing that 20 years ago.
Especially based on like what you were talking about earlier, like for a surgeon to kind of have to like turn it off, be in professional mode, work on these tiny babies,
Yeah.
and then step out of it. And then I wonder
Yeah.
if they kind of become desensitized over time to it, or if they also have like their drive home to let it all
Debrief.
out. and
Yes.
kind
Yes.
of debrief everything.
Yeah. Are you a normal person or a psychopath? Good question. Just kidding. In case I have surgery in the future.
We love and appreciate all of our doctors.
I love surgeons.
They are. I think they have a really cool job. They can go in and fix things and like success done.
Yeah,
Oh.
for sure.
Oh,
Like trying to think of the weirdest things I've seen. One was a sacral teratoma, which is thought to be like the formation of another twin. And this baby was born via C-section, and off the sacrum bone it looked like the size of like a basketball.
what?
Like a basketball like mass. This baby ended up, they removed it and it did fine. Had
Oh.
full functioning of a leg, but
Thank God.
when you like hold a light up to the sac, you can see like bone fragments,
Stop.
hair.
What? The baby was pregnant?
No,
My
it was like
understanding-
it was thought to be like
Siamese
another.
twin? Is that what it would be called?
I don't know, maybe.
Or no?
Sacral, it was called a sacral teratoma.
So like the baby had a twin and it got absorbed, maybe?
Or just
Yes.
never fully formed?
No, never fully formed.
Right.
Wow.
Yeah, and like grew attached to the second baby.
Stuff like
It would have
this.
been like an identical twin, just never
Yes.
fully separated.
Yes.
Cool.
Yes.
Stuff like this just makes it punch you right in the face with how big of a miracle life is.
Oh, for sure.
Like, it's,
for sure.
thank God. It's incredible that more people aren't born with like only one leg or only one eye. It's crazy.
Apologize, my heart's on the outside.
Yeah.
Yes.
Yeah.
It is. It is. I never in a million years dreamed I would see the things that I saw in that little Western Pennsylvania hospital, you know?
Sure.
So again, this is a Natalie, like I'm like really showing my true colors on this
I
podcast.
love it.
Again, my shift was over at 7 and I wanted to go home, and this mom came down and she wanted to hold her baby. And the baby was like on a ventilator. This was before I was a nurse practitioner. And I was like, man, lady, I do not want to get all of this out right now. This is going to delay me going home. I just want to go home. I had every like bad person, good person, the bad person saying like, pick something up so you don't have to so pass this job off to somebody else. So I did it, you know, and she held the baby. We moved the ventilator. We got all the tubes and the wires so she could do skin to skin, which is when they put the baby to the mom's chest, they actually like breathe better.
They do.
It is amazing. It's completely amazing. Here come the tears.
Is that the breathing and the heart rates can all kind of sync?
Yes,
and- yeah.
syncs to the mom, and
Yeah.
like the mom's temperature
Mhm.
can actually regulate the baby's temperature.
Real quick question. Does this work for any old person? Is it like, give me that baby, give me some skin to skin, or does it have to be the mom?
I don't know. That's another one for. Well, I've seen dads do it too, but I always tell moms like the sound of your voice,
Right.
the smell of your skin is like equivocal to you and I eating Thanksgiving dinner, sitting on the couch, and not falling asleep. Like it is like pure comfort. Like their moms. This particular mother got the baby out, held the baby, went home, did my thing at home, came back to work the next day. Everyone swarms me. Did you hear what happened to Isabel? No. You know, immediately, like things can turn like that in the NICU.
Sure.
Is Isabel okay? You know, yeah, Isabel's fine. Her mother went home and had a massive heart attack and died.
No.
What?
Yes. And all I kept thinking is what if I would not have let her hold that baby? Yes.
Wow.
So,
Are you serious?
I'm serious. So then the father, this one was, I think everyone that worked in the NICU was like so emotionally invested in this. A lot of the nurses went to the funeral, and the father, I don't want to stereotype, but he was a very busybody, like very on his cell phone a lot, very important business person. So a lot of his time in the NICU, like he was not invested like the way a mother was. And he then all of a sudden had this newborn baby, no mother,
Here you go.
absolutely had no idea what to do. So like the nursing staff had to completely train this father like through the grief process.
Sure.
And we had, you know, I don't know how it got out to the media that this story happened. The mom was breastfeeding, and breast milk is like so important for babies when they're going through the preemie process. It's like gentler on the gut. You know, with the mother no longer alive, we no longer had breast milk for the baby. So they have donor milk banks. Like at the time we were getting donor milk donated from out of state. And I you know, just maybe technology caught up, or I don't know if this story helped drive it, but we now have a donor breast milk bank in Pittsburgh.
Because
that-
of that.
I'm not sure if it's because of that, but it was like eye-opening, and maybe we played into making it happen a little bit faster. But we were having donor breast milk flown in from a news story or somebody that caught this. So then the donor breast milk came to Pittsburgh, and you know, we still use that today. Like
Wow.
if a mom's having trouble producing breast milk, we, you know, they sign consent just like a blood product. It's filtered. It's you know, all the things that they do to blood products.
Pre-screens and all that. Kind of
Pre-screens
stuff. Okay.
goes through, and then, you know, we order it and keep a supply on hand to help babies because their outcomes are so much better when they use breast milk.
Wow.
But I guess the moral of that story is when you don't want to do something, listen to the good side and
Wow.
do it anyway because
Wow.
I don't think I could have like truly lived with myself if I would have like robbed her of that opportunity of holding her baby. You just never know.
Yeah.
Well, good job. Good job.
Yeah, seriously.
We affirm your decisions.
Mhm.
Well, I don't know. I gotta listen to that good side more often.
Yeah. Wow, I love that.
Yeah, there's lots of baby stories. Healthcare, I think I told you guys at the beginning of this podcast, the best thing to do is get a bunch of nurses to sit around and just start talking about stories that they live through because for some reason we have like no filter on bodily fluids and like we just talk openly about stuff all the time. I was telling some nurses last night that we were doing this podcast and they were like, that would be so much fun. How about you tell this story or this story? And they all just would start laughing. I think it's therapy for nurses to talk about stories like
Sure.
this.
Oh, for
Like,
sure.
so-
All I hear is a future podcast.
Yeah.
Let's set it up.
oh, yeah. If you need
Bring
me
in
to
your
spread
friends.
the
let's do
word,
it.
Yeah, for sure.
you would have, oh boy, they're funny.
Well, was there one story last night that everybody was like, oh, you have to tell this one?
One consistent one.
Like there was a good one we just
Yeah.
saw go across the eyes.
Are you talking
on.
about the one I shared earlier? Upstairs or no? No, like obviously in labor and delivery, you're pushing babies out.
Uh-huh.
There's been bodily fluid splash in your eyes, splash in your face, stuff like that.
You don't have a mask on? Like a visor?
Well, you're supposed to. That is the correct answer. You're supposed to wear gloves. You're supposed to use universal precautions. But in the real world, not everybody listens,
Yeah.
and they learn their lessons the hard way. Yeah.
Yep.
It's fun. I mean, I've had a full change shower before. That's why the hospital provides you scrubs.
What is a full change shower?
I mean, like, been drenched with bodily fluid that, you have to go shower. And
How are you drenched in bodily fluids? Is it like projectile vomiting? Is it, oh no, surgery went horrible and now I'm covered in blood?
well, with frequently my babies, oh, actually they do. I've been peed on during circumcisions many times. We turn your back and woo,
Oh.
they get you. But obviously in labor and delivery, amniotic fluid goes flying. Poor nurses, labor and nurses, they've been kicked in the head so many times by a mother. You're like, no, none of it's on purpose, but they're holding legs as they, boom, occupational hazard. I think every nurse that I've worked with has been kicked in the head.
Have you
At
been
least.
kicked in the head?
I've never. I stay on the other side of the room and just catch that baby.
Does it fly out?
Not always. I've delivered a baby before. That was super cool.
Yeah.
Not by like any, it was just chance. There was a lot going on in the room. There's 5 labor beds that were active and the doctor was managing one that I was in the room and he had to go attend to another one. And he was like, can you stand here? And I was like, oh, sure.
Got this.
So he came back in the room and the head was like already out and he was like, I'll stand behind you if you want to finish it. I was like, okay. So like when you're pulling the baby out, like, oh, it's a weird feeling, you feel like you're gonna pull their head off, but somehow they're just so pliable. It was the coolest feeling ever. I mean,
Yeah.
I've always wanted to do it. Like I've always wondered, like, if I was in the back of a plane and someone went into labor, could I do it?
Wow.
Or if I was at the mall and someone went into labor, could you do it?
You think you could now?
You're just always on the lookout.
Yeah.
Yeah.
For pregnant women.
Yeah.
I
You've
did it once.
delivered.
I'd probably phone my friend on FaceTime. Hey, this is the situation I'm in. Can you talk me through it? I definitely would need to phone a friend, but it is pretty surreal.
Yeah.
I'm trying to imagine that friends in a meeting. FaceTime. Oh, it's Natalie. Oh, what is this?
Can you imagine?
Oh my gosh. Jared's delivered babies before.
You have?
Yeah. So I was a medic in undergrad.
Oh yeah, so you
And then-
probably have crazy stories
Yeah.
too.
Yep. And then helping with both my boys. I was active with that. So
Yeah.
We have
That's fun.
never asked you if you have any crazy, weird stories.
I bet he has way more crazy stories than me. Like
yeah, being
No,
in the
your
field,
chicken
you
bone
see
one's
some
pretty
things.
crazy.
yeah.
medics. Here I go again. I hope you don't have to bleep me out. I feel like they're the most underrated profession ever. Like they are at the forefront of every emergency. You call
Wow.
911, that's who's coming to save you. So,
Gotta appreciate them.
right. I mean, you probably save more lives than anyone. Oh, Con, you please share.
No,
Yeah,
that's
tell us
that's
something.
for another time. I'd have to think about that.
Okay,
Yeah.
okay.
You know,
So,
sometimes the medics bring babies that are delivered out in the field wrapped in aluminum foil.
What?
correct. Yep.
Is that what is that?
Yeah.
Yeah, they come in
The-
wrapped in aluminum foil.
Why?
So babies, when they're first born, they're not very good at regulating their own body temperature. That's why like putting them on skin to skin is great because it helps the body learn how to regulate. And so if you want to keep something warm, wrap it in foil.
But isn't it like uncomfortable?
It's not like
Truly.
Reynolds
Reynolds
wrap.
wrap.
It's not like that. It's a softer, just reflective shield, basically.
Oh, like the blankets.
yeah, like after you run a marathon, how you would see like those kind of things.
Well,
Yeah.
that's not
So it just
foil.
kinda- It's basically
Looks like
foil.
aluminum foil.
yeah.
Oh man, okay.
yeah. I mean,
And then-
I'm assuming if you're in a pinch, like grab some foil. But yeah.
Wowie.
And then what else do they like?
Yeah.
Like how you have to? Do you like if you have you delivered a baby in the field?
No.
No.
Never had to.
I imagine that call would be really.
That was
fun.
like one of my greatest fears in college was the basketball coach lived really close to my dorm and his
Oh.
wife was pregnant and she just kept, she gets closer and closer. And we knew that you're 30 minutes from the hospital.
Yeah.
And I had several friends, like we were all medics, and we were like, we really don't want to get that call. like, hey, Coach Beeler, I'm going to go visit your wife now. Yeah.
You've told me a story once about how I think it was a friend of yours was not close enough to the hospital and something was going wrong. They had to get to the hospital to deliver the baby.
Correct.
You know what I'm talking about. Tell your story.
If the umbilical cord is wrapped around the head, depending on where you are at in your training, you may not be qualified to do anything. Especially like if you're like a basic
Wait,
EMT.
what does that even mean? Like that's like an emergent situation. You couldn't stop and say,
Right.
"Hold on, I'm not qualified to do that." Like you.
You can. So if you're a basic EMT, if there's umbilical cord around the neck and they're delivering, it's you hold and pause and basically race to the hospital. And so it was a friend that had to do that, but it was more holding the head and keeping it in. And so he had
Awkward.
like a 25-minute ride with
Oh.
his hand mostly inside this poor woman to make sure that the baby didn't come out and that didn't get choked. But he's like, it's just kind of quiet,
Aren't there?
and you're like, what should we talk about?
That's my hands there.
Yeah.
There's oddly like that exit to Oakland and Pittsburgh. There's been a lot of babies delivered on that exit.
Oh my
where they
gosh.
just didn't quite
Yep.
make it.
Exactly.
I don't know. Like I just feel like aren't you protected by like Good Samaritan law or something? Like sometimes you can't tell a woman not to push. Like what if the baby
it's-
would have came out anyway?
Right. It's definitely been a minute. I think when you have, like, I had a national and state license,
Yeah.
I don't think Good Samaritan really applies because then you're held to those higher medical standards.
Oh boy.
Wasn't it also that there was really nothing that you could have done safely? Like if she had delivered the baby, the umbilical cord would have strangled it, but then it's not like you could have just removed it. Is
Right.
that correct?
Yep, that was the risk.
Just
or the fear
curious.
of it. Yeah.
Yeah.
Could you tell which way you could remove it? Like, were you thinking in your head, I could remove
I wasn't
this?
there, so I had no idea.
Oh.
Again, this is just a friend recounting the story. It was like, how was your day? And he's like, well,
Bad. It was
What
a
a little
bad day.
awkward.
Bad situation to be in. Have your hands tied.
Literally.
Yep.
Literally. Wow.
What is something that you hope for in the NICU or like in your job? Obviously like graduation, but is there anything where when you go into work you're like, oh, I really hope this unlikely thing will happen? Do you know what I mean?
It sounds so simple, but like, sometimes it's just nice to hold a baby. You're so busy putting IVs in them, changing airways, doing all these stuff to them, like it's rare that you get to sit down and just hold the baby, like in the little rocking chair. So I wish for that every day.
I love
Hold
that.
the
Okay.
baby. Sounds so silly, especially like I work Christmas this year. I haven't worked a Christmas in many years, so it's my turn. So I'll probably sit there and like feel bad for myself. But to make myself feel better, I'll sit and hold a baby,
Yeah.
like because they don't want to be there either.
No.
I just feel bad about that.
Okay, this is kind of a weird question, but is there anything that a pregnant woman can do to prevent like an early birth, or is it just like something that
Yeah,
happens?
oddly, prematurity has like no face.
There's nothing you can do to prevent it?
Well, there are things like, preventing smoking during pregnancy, but in general, prematurity like does not have like risk factors,
Wow.
So the patient population in the NICU is not people that had like gave negligent care during. It really just picks and chooses. Sometimes, high blood pressure can cause preterm labor. There's multiple risk factors, but there's really not one thing. Sometimes babies just decide to come early. And which is hard because then, I feel like the parents always feel like, did I do something wrong? They have a lot of guilt.
Yeah.
Like, this poor baby's here early. And so they get past that. And then you ride that roller coaster with them of all the things that happen. And then you get to be there in the end when they take the baby home. So,
That's such a relief though that there's kind of nothing you can do as long as you're not like smoking or drinking while you're pregnant.
yeah.
Like it takes some of the pressure off, I think.
There's a girl in the NICU that I worked with. She's a nurse. She was born at 24 weeks gestation, and she's a nurse in the NICU now.
Full
So
circle.
I'd say she's probably like in her mid-30s now, but she was trached. So she has like the trach covering, and in the NICU, there's nurses who have been there like forever. We call them the bubbas. And then we have the bunnies. So the bubbles are like the ones that like have been there for years and years and years. And some of the bubbas took care of her
Wow.
as a nurse. They remember taking care of her.
That's so sweet.
Bubbas and the bunnies.
I love that.
Yeah, I Googled like the average. I don't know if Google's right with the statistic, but the average like work span for a nurse in the field is 9 years, only 9 years because of burnout.
Wow.
But I don't think that's true for my patient population because I think people fall in love with like NICU nursing. Once you're a NICU nurse, like obviously there's nurses who have been there 40, 50 years old. They're like still connected to the profession. You
That's
should see
amazing.
the board in the NICU. There's like a Christmas card board. Like, remember this one?
Yeah.
Remember this
Yeah.
one with all like they send pictures in yearly to the NICU team and like
I
you
love
get to
that.
see the people progress, and especially with social media, a lot of like the nurses stay in touch with their patients that way, and they're just so grateful to be parents and to be living life. They want to share all those moments because the road in the beginning was so rocky, so they don't ever forget. So
Yeah.
the NICU gets tons of gifts, like tons of there's one foundation that lost a baby, and every year they like buy every baby in the hospital a teddy bear,
Right.
and like lots of stuff like that.
I love that.
And we were talking about like prematurity. Like, there's been a couple famous people, I won't say who they are, that had NICU babies too.
Wow.
Probably have the most top-notch healthcare ever.
Yeah.
Still have preemies.
Yep.
Yeah.
Do you have any advice for new parents or like people who are pregnant?
New parents. I would say never wish the next step. Where I am in life now, like my kids are teenagers, and I feel like parents are like, I can't wait till the baby can walk. I can't wait till this. I can't
Yep.
wait till that. Like,
Appreciate every stage.
appreciate every stage because it goes by so quick.
Yeah.
Like, I can't
Yeah.
believe my babies are in high school now. Like, I know, Michelle.
Yep.
Just it's I think more important than being a nurse, I mean, us being a mom. Like,
Yeah.
I just wish that for everybody. And I hope that for everybody. And I'm happy to be part of the lives of people who can come out on the other end, you know? It's good to see.
I love that.
Maybe they'll be taking care of me one day.
Yes. Maybe you'll be the reason that they switch to NICU.
Wonder if any of my children will be like me.
Like, it's all right. We'll have a conversation while you're doing all this.
Wonder. Yeah.
It's a chicken bone free zone. Don't worry.
You know, that chicken bone was a blessing. It steered me in a
Right.
completely different direction.
Yeah.
So do you see yourself being one of those, like just continuing on with this so that you'll be like that 40-year pro someday?
Like the Baba.
Mhm.
I mean, I've had every reason to walk away from it, and I can't. Like, it's like a love-hate relationship. Like, it truly is not a glamorous job. But I just, you know, it took so long to figure out like where you're supposed to be in life. And I just feel like the NICU is where I'm supposed to be, you know?
Oh.
So
It's awesome that you're there.
yeah,
Yeah.
I mean, I definitely reduce work hours there, but I don't think I can ever give it up. No.
That's so cool.
Even working on Christmas Day.
Will your family do something like on Christmas Eve or the day after? That
Oh,
way you're not like
gosh.
missing anything?
Yes,
They
of course
will?
they will. Yeah.
That makes me so happy.
Yeah. Yeah, so we'll have a good Merry Christmas Eve.
That's exciting.
Yeah. It is. We'll dress all the babies up like little baby Santas. They usually pick a theme every year. I think this year they're elves. Elves on the shelves. So someone will donate like little like stockings, leggings, and they'll get little hats and
So cute.
Okay.
yeah. They've been peas in the pod. What else? You know, usually when the Pittsburgh sports teams are doing well, they dress the babies up.
Didn't the Penguin sponsor it a couple years ago?
Yeah.
They got little jerseys.
Oh yeah, Mary Lemieux's son
Right.
was a preemie, and so he donated like the waiting room. The
Wow.
Mary Lemieux, Austin Lemieux, I think his name is
Uh-huh.
Austin Lemieux. Yeah,
That's
he's
sweet.
Yeah, I think that was when. Oh, I'm trying to remember. I think it was when my youngest son was born. I think this was going through because we had got all this Pens gear.
yeah.
I think
That
it was
is
about the
cool.
same time. Yeah.
There was so the March of Dimes is like a big sponsor. How the March of Dimes, I'm probably saying this wrong, but someone can look it up and clarify the truth. One of the John Kennedy, the president, JFK, his son died from prematurity, and started the March of Dimes or supported the March of Dimes, and that's when surfactant came into play. It was after the loss of one of the Kennedy babies.
What is surfactant?
Oh, surfactant is it's like a dish soap consistency. It's pig surfactant, actually. It's from a pig. But they put it down a breathing tube for premature lungs. So like when the baby's lung collapses and is not strong enough to open back up to breathe, it's kind of like dish soap consistency that goes into their lung and like
Helps them.
be able to open and close their lungs.
That is amazing.
It is amazing.
It's gross,
It
but it's amazing.
is gross, but it's definitely a game changer for the world of neonatologies because they can help grow the babies.
Yeah. Do you ever
Yeah.
have to apply the jelly?
I have. Yeah, I have.
Wow.
Yeah.
Is it hard?
Well, you know, you put a breathing tube in them
Okay.
and then you just like kind of squirt it into the tube and bag it down. So not really hard. It's a procedure.
Wow.
But they respond really well to it. Yeah.
That's great.
And from pigs,
I think it's pigs.
which when I think of
Pigs.
animals that
like
breathe really well, I don't think pigs.
Yeah, they.
Where's Google?
Yeah.
I want to say it's.
Yeah.
Well, I
Maybe
need
they
to
just have a
like
higher
fact check
amount.
that
Yeah.
one.
Interesting. Okay.
I'm pretty sure it's pigs.
What animal would you say breathes really well?
No idea. I don't know where I was going with that. Other than like, I wouldn't know if I would naturally go to a pig.
If someone asked me that in class, I'd be Googling,
Yeah.
Jared, how do I respond to this?
Oh my gosh.
And then
Yep. Paging Dr. Google.
Yeah,
Dr.
for sure.
Google. Oh, that's the worst when you have a patient that looks up answers and has an answer before you have an answer, and you're like, well, that's kind of right, but not fully. And
Yeah.
be so dangerous to have just partial information. That's
Oh yeah.
why you go through training and why we appreciate everything that you do.
Yeah.
Hmm.
We have technology has changed so much since I started. We have cameras in all of the beds in the NICU. So like if the parent can't be there, they can log on to the camera and like see the baby. But
That's so cute.
you'll be in the bed doing something, and next thing you know, your phone will ring. Hey, can you make sure you move the blanket a little to the right or the left so the baby can see the little stuffed animal? We're like, oh my gosh, it's like big. It could be a good thing and a bad thing.
Sure.
Is it one of those things where you look at the phone and you do like, I can't react because the camera's right
Yeah,
there?
Yeah,
the
exactly.
camera's always rolling.
Yeah, be
Oh.
cool. Be cool.
Right.
Yeah.
You look at the camera, ignore it. You're doing what you're doing.
Yeah.
Cool.
If you have weird stories, weirder than what Natalie had, I
Do you think
doubt
you can
it.
top that? I don't know.
Yeah. You think you could top of that?
I'm positive they can top that.
I don't know, man. That chicken bone one was kind of crazy.
Yes, we definitely didn't see that one coming.
Mhm. Yeah.
I'm sure.
Leave a note in the comments or email us.
Yeah, we'd love to hear from you. Well, Natalie, thank you so much for coming and spending
Yeah.
time with us and just sharing your heart and your passion for kids and sharing some
no
weird
problem.
stories that we never saw coming. So